Okay, welcome to the Easy Peasy Mealtime Show, where parents and professionals get together and talk about children who struggle to eat. I am your host, Dawn Winkleman. I'm a speech pathologist and feeding specialist, and today we have three moms. We have Mary and Michelle, and Tina's going to be coming on. Jen's going to be coming on any minute. Tina's going to be coming on, and we also have a couple of other parents. We're getting some questions via email. So I have my other computer up. So you can email me if you can't stay for the show, and I'll ask the questions from email onto the show tonight. So thank you so much for having us during your lunch hour. We're trying this new time and I'm excited. I've been getting some therapists saying that they'd come in for a few minutes during their lunch hour and then get back out. So we're excited. All right, let's talk about feeding children with Down syndrome. So this is the month, right, of awareness, and we're trying to, make all the therapists a little bit more comfortable this month in learning about some feeding tips and also help parents. So Michelle, why don't you start us off and tell us a little bit about your son, and we're going to just kind of start there, and then if you can do the same thing, Mary, and then we'll talk about feeding. Go ahead.
I have a son, Matt. He is 3 years old. He just turned 3 about a week ago, so he's newly 3. When he came home from the hospital at 3 weeks old, he came home on a NG tube and had significant swallowing issues, wasn't really, failure to thrive, wasn't really nursing very well, wasn't really taking the bottle very well. And we had many issues surrounding feeding at that point. We decided that we would take a oral motor approach. We had read Sarah Lindahl Johnson's Oral Motor Myths article and found a talk to a therapist right away and got him nursing and off the NG tube in no time, and have just run with it from there. We've sort of taken the approach of, can you hear me okay?
Yes, we can.
Okay,
perfect.
Great. We've sort of taken the approach that unless there's, something really wrong, we're going to assume there's nothing wrong, and we just continuously worked on those oral motor skills. So now he's 3, he's got pretty good oral motor skills, and eats a variety of foods, eats just about anything that you put in front of him. In some form or another. There's some caveats to that, but yeah.
Well, I've seen it in action. He's got great feeding skills. Jen, how about you? Tell us a little bit about your kids and some of your feeding history.
Jacob is 2 and 10 months, almost 3. He and Mac were in preschool together, so that's how I met Michelle. When he was born, he had low blood sugar, and they were trying to 11 tries to get an IV, and I'm like, just feed him. And the neonatal nurse practitioner said, oh, he's never, I said, bring him and I'll breastfeed him because he's my 3rd. He's never going to be able to breastfeed. He's going to have an NG tube. I'm like, then just give him a bottle. And sure enough, that's all he needed. He breastfed awesome.
Great.
I feel like, yeah, he's a rock star. At 18 months, I have a video of him eating a French fry at Good Times, and there was some concern about aspiration, and so part of my therapist said it's not a big deal, just eat it, and part of my therapy said don't do it. By the time we got the swallowy bowel, which he doesn't have any aspiration problems, we kind of missed that window. So he anything pureed he eats. I make most of his food, and chocolate. So chocolate rice Trix, chocolate Cheerios, even a Thin Mint he'll take down every once in a while, but other than that, he just throws it. Wants nothing to do with it.
Wow. And when you're talking about a swallow study, for those of you who are not familiar, did he have a modified barium swallow study? So eating and drinking barium, which tastes horrible, and then trying to get an x-ray of a child who, really doesn't want to eat and doesn't want to have some solid foods. And then we're having them drink and eat barium, which really exacerbates the whole not wanting to eat. So it's really a balance of, trying to handle medical issues and being able to find out what's wrong. So no aspiration, yay, which is a myth.
no aspiration.
You brought up two myths of working with children with Down syndrome with feeding issues. One is that the myth is they can't breastfeed, and that is not true. And the second myth is that because of their low tone, they're going to aspirate. So they thicken our kids' liquids and without really knowing whether or not there's a problem. And so those are two feeding myths that are just out there. And I'm just so shocked at how many, GI doctors as well as pediatricians are really giving that false information. In fact, in California, where I was at before I moved here to Colorado, I won't mention the hospital, but it's in Riverside. And the doctors there, if a child was born with Down syndrome, they immediately put in a feeding tube. They didn't even let the parent have a chance to breastfeed, try bottle feeding, giving, any type of feeding advice from a speech pathologist. And so those are some really, I always think that we're past that hump. And then I hear all of these, experiences from parents. And I'm like, wow, I really thought we were past that back in the 90s, but apparently we're not. So it just, Lindsay's commenting on the other side, it just makes her so mad. And it makes all of us mad because really, we're, our kids, when they go in for a modified barium swallow study, they're drinking foods they don't want to drink. They're eating foods they don't want to eat. Oh, yay, you're back on. Great. And they're getting radiation. And so this is a serious procedure for our kids. And unfortunately, speech pathologists as well, we're always afraid that we're going to miss something. And so we will recommend these studies just as a precaution because we're afraid that what if we miss it and the child aspirates and then is in the hospital for weeks and then on oxygen. And so it's that balance of, if you're not really skilled, you want to order a modified barium swallow study. If the pediatrician is not really sure whether or not this child should be even eating, they do that. And so it's just a hard balance. And, there's just so much more education needed in the field of swallowing and feeding and Down syndrome. And there's just not a lot of therapists who really specialize in our population. And so it's hard to get all of that information and advocating to the hospitals. So great. Jen, you're back on, and we're just kind of introducing about our kids and some of the feeding challenges. Would you mind sharing yours?
Mary?
Can you hear me? Yes, Mary, sorry. Yes. Sorry.
Gabby is my little one with Down syndrome. She's a twin. She's almost 6. And her and her twin were early. She had a feeding tube for about 9 months. I was able really to get her to stop her feedings from the tubes pretty quickly, but she had the big wide cut nipple. She's been on great food for a really long time. Just has trouble swallowing any chunky food whatsoever. Also, another one of our problems is we're on GAPS diet. So we've had a hard time progressing just because I can't figure out, what foods to give her. A lot of times if we go for speech or oral motor treatment and they're like, oh, give her Cheerios or something that she just can't eat.
Can't eat, right. Oh my goodness.
Trying to figure out what I can give her to help her progress is kind of difficult.
Yes,
so I
absolutely.
all of her food.
Wow. So both of you, Jen and Mary, you guys are just pureeing all day and really having a lot of work here for just to feed your kids. And that's another struggle that some of our kids get stuck on is transitioning from purees to solid foods. And there's a couple of reasons for that. One is our kids have more respiratory issues than the general public. Because of the way that their nose are shaped, the increase in congestion, they have more respiratory issues. And our kids will always, number one, pick breathing over eating because we need to breathe to live. And so they're going to always do that. And so puree foods are very easy to breathe through. You're able to suck and still breathe and exhale without a lot of effort. And for our kids, it is a lot more work of breathing during the feeding process. They're having to really focus on their posture, really focus on their head positioning, where, their peers are not really focused on some of those skills. And so we get stuck on purees quite often, and at different ages, as you guys, have very different age groups here. And it's imperative to kind of get them past that, because we're missing that feeding milestone, right? So even though our kids have Down syndrome, we still have to make feeding milestones that have to do with the oromotor cavity, because then feeding milestones precede speech milestones, which precede language milestones, which precede literacy milestones. And so it all starts with feeding. And I brought a couple of tools to kind of show you guys some ideas. There is an amazing therapist, and Mary, you're in Arizona, so this might be of really good assistance for you. There's a therapist out there. I call her the queen of feeding. Her name is Marcia Duncline, if you're not familiar with her. And she has an approach called the Crumb Approach. And basically, you can take any tools, these are Play-Doh tools, that you can take some food and you can roll it and crush it and use crumbs and sprinkle crumbs onto the puree. And you can do that with having, different bowls or shot glasses with different sizes of crumbs. So they can be really, really powdery. So thinking about taking, a couple of puffs or Cheerios and kind of rolling them out really, really hard. So it's like a powder in one bowl, and then rolling it just a little bit less in another bowl so that they're a little thicker crumbs. You get the idea. And then a little bit thicker, a little bit thicker. And then the child can pick which sprinkles they're going to put on their puree. And so they slowly but surely can get a little bit more texture, Now, during this time, there's going to be some gagging. There might be some retching, maybe even a little bit of vomiting, because this is a texture that they haven't had before. But that's one really good strategy to be able to help transition from purees to solids. Michelle, what was your techniques that you used with Mac?
I actually just have a question for you about that. And is it okay if they gag a little bit and retch a little bit? And how do you know when to step in and save them, and when to feel scared, and when to show them that you feel scared, and that whole thing? Because I feel like that with Mac, we just, if he started to gag, we just let him figure it out. Right. And I just showed no emotion, but what's the line?
Very good. Actually, that's exactly what you're supposed to do. If we see our kids have a gag reflex, so let's just, I'm going to initiate it. So I'm going to gag, right? My mouth is open. My tongue is usually cupped to do a gag. If I was to stick my pen down my throat, that's the first thing I do. You'd see, shoulder movement, neck movement, and you'll usually vocally hear something. So if you can hear a voice, that means they're not choking. If you can hear breath, that means they're not choking. And so a gag is absolutely normal. If we think about our hand as a tongue, our gag reflex is here in the front part of the tongue as we're younger, and it slowly but surely moves back as we age. If we get sick, it kind of moves forward. I had mono a couple weeks ago, and for whatever reason, being in grad school, we had no gag reflex, right? Everyone's in my throat all through grad school. And so we were laughing. We all graduated and none of us had a gag reflex. But I had mono a few weeks ago, and my gag reflex is about here. I'm gagging on smells and brushing my teeth. I've never done that in my whole entire life. But as you get sick, your body starts to prepare you with different reflexes. So that's what a gag reflex is to protect the child's airway. And yes, Michelle, exactly how you reacted. You just, don't have a flat affect. If they're gagging, you're just letting them know, hey, I think that you're okay. It's when there's a choke. And that's when, our kids turn blue, the eyes get really big. There's no breath sounds. There's no movements with the mouth. It's usually they're stuck like this. There's no pumping of the tongue. And then, of course, that's when we need to intervene. But we want to make sure that, we can just give them positive feedback, like, you're okay. That's all right. Your mouth is just learning about that food. Your tongue is just learning about that food. Good job. And kind of progressively have them take that next bite, That's a really good comment. Any additions to that, Jen or Mary?
No.
Are you guys experiencing gagging
There's
and
not
coughing?
a good color on their face. Just
yes.
some of their shirt.
Both of you?
Yeah.
So
yeah. I think he does it to try to get out of eating stuff.
And they can use those behaviors, because if it got them out of eating once, They think it's going to work. So then they have this behavior to try to see, hey, is this, it's just like bedtime, right? If they beg a few times then and you let them have it, then it just moves on. Some positive motivators is bubbles or any other nonverbal reinforcement. So they don't gag, you blow a few bubbles and you don't say anything about it. You just blow a few bubbles. I don't like a behavioral modification kind of issue with feeding, but if they don't gag, you blow a few bubbles, you set the bubbles down. They take another bite, you blow a few bubbles, you don't say anything, put the bubbles down. If they like bubbles or something, I'm just using that as an example to kind of positively reinforce them. Hey, you're doing this, you keep going, I like it, you're fine, there's no problems. And then it keeps them at the table longer, kind of trying those foods.
Mary, did you have a comment?
No, I was just going to say, Gabby just started feeding herself
Yay!
months ago. So that's kind of still the issue of getting her to feed herself also and to try the new textures.
Yes, great. Is she sitting up okay? Good postural stability?
Yes.
Great. And how about Jacob? Is he able to sit up?
Yes, yeah. Part of our problem, we don't get to the gag too much because he doesn't want the solid foods in his mouth. So something that I know he likes, a muffin, a brownie, because, you know, it's chocolate. I have to forcefully kind of put it on my finger and put it in his mouth and squish it on his teeth. Once he gets the taste of it, then he's more willing to let it go in his mouth and eat more of it. But just like he just clamps down. A French fry, he'll eat the ketchup with his finger. You put the French fry in the ketchup and try and give it to him. Doesn't want that solid thing near him.
Interesting. So with chocolate, so he's more open to the chocolate. Is there any signs of reflux after chocolate? Because what in my experience too is that kids will have those sweets, right? Our kids love sweets. And so they love that sweet taste. But the problem is that our kids experience a lot of reflux. And so they try the chocolate, then they're like, okay, maybe I can do this. Maybe it's worth, doing all this work because I love the taste of chocolate. But then they reflux after the chocolate and they refuse to try any other foods. Is that his experience or
I don't
no?
think he gets reflux. No, I think it's a genetic desire for the chocolate. It comes from myself, my grandpa. We have a little addiction, so I think it comes by it genetically.
Oh, okay. Well, some of the questions that I got from therapists, and Michelle and I talked about this too, is going over some signs and symptoms of reflux. And it's funny that chocolate was on my list, so this kind of ties in really quickly. Some signs and symptoms of reflux are actually signs that in the medical community, they just kind of go, oh, that kid has Down syndrome. But it's really reflux and it's a medical issue. So watering of the eyes, clearing their throat, coughing, food refusals, arching of their back, sticking out their tongue, open mouth breathing. These are all signs of reflux, which sound very similar to our kids. Gagging, the refluxing of some food, so having that regurgitation kind of come up and then swallow again, which I see with our kids quite often. Trouble swallowing, which leads to a modified barium swallow study, but really it's just reflux. Increased mucus and being nonverbal. These are all signs and symptoms of reflux that sound like our kids. And when I talk to parents about these signs and symptoms, they're like, oh, that does sound like my kid during mealtime. And then they bring it up to their pediatrician and their pediatrician's like, oh, your child has Down syndrome. But any other peer, a parent would come and they'd say, oh, let's try some reflux medications. Let's get on this right away because this could really burn their esophagus. Any thoughts on that?
Yeah, I would say, as you were mentioning them, I'm thinking, yeah, he does that. Yeah, he does that. Yeah. But like you said, it's when we go through the pediatrician, everything is that, I'm pushing too hard. He just has Down syndrome. This is just what it is. So it's hard to advocate and not feel like I have like Munchausen by proxy because
right.
Yeah.
I hear that a lot too. I'm writing down as we go through this, I'm writing down all these myths and just more, and more, I just feel like all that information's out there. And then I talk to families and I'm like, oh, we're still fighting this battle too of pediatricians and other medical professionals saying, let them just be happy. You don't have to push them so hard. Right.
Yeah.
And that drives me absolutely crazy. And I'm like, we would do that with their typical peers. We have to push them. So just because they're happy and so darn cute doesn't mean we can't push. So
well, and it frustrates me that they don't want to look at, this extra chromosome can affect so many things, how they metabolize, so many things, but they don't want to look at it. They just want to say it's Down syndrome, so we're not going to do anything.
Yes. And metabolizing, let's get into that next. But Michelle, did you have a comment on that?
No, I was just agreeing with you guys. Yes.
So yeah, let's talk about metabolizing. So I'm baffled again by some of the medical community that is unaware that, our kids have a higher incidence of diabetes and heart issues and metabolizing issues and reflux and, gluten intolerances and, the list just goes on, and that they won't treat or look at these complications because their primary diagnosis is Down syndrome. And I know, Michelle, we talked about this too with thyroid issues and stuff. Do you want to comment on some of that?
So in the research that I've done and in the many parents that I've talked to on the Down syndrome groups I'm on Facebook, thyroid is a huge, huge issue. And the symptoms of hypothyroidism match the symptoms of Down syndrome almost 1-for-1. And so getting thyroid checked and not taking no for an answer when you see those hypothyroid symptoms is huge. Seeing a biomed doctor that specializes in thyroid, a lot of the allopathic doctors, they go by TSH level and that's it. And we know that there's more to it than just TSH. And so, digging deeper. And like you said, Jen, that advocating part is really hard, especially when doctors don't want to listen to you. So finding the right team.
Yes. Which is so hard because, there's a lot of willing people, but they just are not very knowledgeable. And for us trying to get continuing education specifically in Down syndrome is so challenging. It's so challenging. And, I think the beautiful thing about my experience and my journey in feeding and swallowing is that I always had amazing parents who were willing to teach me. And I've always been open to those parents. Every time they're like, hey, I'm going to this class and would you like to come? I'm like, sure, I'll go. It's being able to, try to make your own team sometimes because it's on you guys, unfortunately, because there's really not a lot out there that is specific to Down syndrome. Some of the feeding courses that I go to get, more strategies under my belt as a feeding and swallowing therapist, they will talk about Down syndrome 15 minutes, autism 15 minutes. And, and we're stuck, cerebral palsy 15 minutes. And like, these are our kids. These are the kids that are coming to see us. But we're talking about strategies for, some typical peers, which, we've got that. And when we're talking about challenging caseloads, when, parents are coming to me at the very beginning of my career and they're like, okay, my baby has Down syndrome. They need to have their heart surgery, but they have to gain 7 pounds in order to have their heart surgery. Help me get there. And of course, I'm like, I got this. We're going to do butter and cream and we're going to do all this stuff. And that's the worst thing to do, right? Because I wasn't trained in that. I had to go and get continuing ed about, how we're going to manage, weight gain, how we have to do that slowly so not put more pressure on the heart. It really is a specialized skill. And there's nothing out there for feeding therapists, pediatricians, et cetera, that says, hey, this is my specialty in Down syndrome. And so that's why I think it's hard to find a team. Has any of you taken your therapist to your doctor's appointments by chance? Michelle, let's start with you. Go ahead, Jen.
Actually, my speech therapist is here right now.
What? That's amazing!
She comes with me everywhere. We went to the feeding eval, and they were checking us in, and the guy says, "Here's one for you." He's giving me my sticker. Here's one for Jacob. Here's one for your my partner. So yeah, I take her with me everywhere I go.
That's so great. Well, welcome. I see you barely. Thank you. Are you agreeing with some of the stuff I'm saying here?
Yes, you're nodding my head. Yeah.
Right?
Absolutely.
Oh, it's so hard. It's so challenging. I'm so glad that you're here. So there is a perfect example of building a team. Oh my goodness.
Yes, it's hard, specifically to Down syndrome, especially.
Right.
And then there's presumptions just with that label that aren't always true. And every child's certainly very individual with Down syndrome also.
Absolutely. There's a spectrum there too, right?
Mm-hmm. Absolutely.
And I find that physicians especially will listen to moms more if we're there in the meeting. And it only takes once usually, right?
Yep.
It only takes once, I go and then I just say, hey, you know what? These are the signs and symptoms of reflux. Mom here would like to do a trial of meds for 3 weeks for the reflux just to see how it goes. I promise to do all the data, we'll all work together as a team. And then I don't need to go as often because then the pediatrician's like, oh, wow, this mom is on it, right? And then they're not looking at you like crazy.
They know you're there. Yeah.
Which is an expensive cost to have a therapist come to your doctor's appointment, especially when, they're 45 minutes late to see you. But I think, if you do it once, sometimes or every single time and having your therapist on the couch with you really does make a difference because I think that they take you a little bit more seriously, even though you're the parent and you should, be taken seriously at day one.
No, they do. They listen a lot more. Absolutely.
Mm-hmm. Mm-hmm. Yeah. Mm-hmm. Mary, how about your experience?
I try not to speak to my pediatrician. I go in and I get her to sign the papers for her DDD forms and for speech and stuff, and that's about it. I don't share any of her lab works with her. I don't share my supplements, anything.
So you're like, all right, you're there to write prescriptions.
She's not even there for that. I don't even go into that.
So who's your primary? How do you?
Dr. Norman Swartz is who I get all my.
Okay.
He's amazing.
Great.
Yes.
Oh, I guess I didn't realize. So all three of us see Dr. Norman Schwartz then.
Okay.
I wasn't aware of that. Dr. Norm is a biomed in right outside of Milwaukee, Wisconsin.
Yes.
And he specializes specifically in thyroid and in issues that our kids with Down syndrome may have. So he is an amazing resource. He's had, 40 years of experience and he's worked with our kids for that long. He specializes in kids with autism as well. And there's some overlapping features between the two. And so we all trust him implicitly. And so a lot of us sort of issue the allopathic doctors in so that because doctors like Dr. Norm Schwartz are more welcoming to getting to the bottom of the problem versus just saying it's just Down syndrome.
I get it. I worked very closely, and we talked about this too, Michelle, with a biomed doctor for 15 years. His name's Dr. Wooler, and he specializes in autism, Down syndrome, and specializes in hormone issues as well as all the biomed stuff. And I loved working with him because he was always like, the parents would say, my child is grinding their teeth. And I would say, well, as a speech pathologist, here's this. And he's like, oh, we need to get him on methyl B12. And I'm like, what? The pediatrician just looked at her like, well, that's Down syndrome. And he was like, no, we need to try B12. B12 helps with teeth grinding. And I didn't know that. And so it was, such a great collaboration to be able to talk about, what I would do from an oromotor standpoint and what he would do from a medical standpoint to be able to stop the teeth grinding and, not having our kids going to the dentist constantly. And when they're already orally averse to foods and then now, having pain in their mouth. So I love that. I love that you guys are all going and thinking outside the box. That's fantastic. So you're doing GAPS, Mary. Anyone else doing any dietary modifications? That was one of the questions that we had was what dietary modifications are parents doing and trying and seeing? So who wants to start there? Mary, you want to start?
Well, with GAPS, with Gabby, I think they were pretty close to consider her failure to thrive because she wasn't eating. And so once I just took her gluten-free, casein-free, she, tripled what she was eating.
Mm-hmm.
But, still I was having a lot of problems. She had a period of regression for a couple of years. So with GAPS, we were able to reverse that. She still has a lot of trouble with yeast and eczema. It's a lot better than what it was.
Fantastic.
And then the rest of my children are on GAPS.
Oh, how nice. It's so hard. We started, we went gluten-free and we're not dairy-free. We just use goat products. Mm-hmm. So just because my nephew has celiac and every time that he would come over, we were all scrambling, trying to hide foods and move foods and change foods. And my husband with that dietary change lost 40 pounds and which was crazy because, I know as a feeding therapist that those are the things that cause inflammation and cause our kids' bellies to kind of have that Buddha belly look. And, but I never really thought about it in our own lives. And we both I dropped a dress size and he lost 40 pounds and all we did was change to go to goat milk. And it was very interesting how that changed in our lives when I'm doing this and supporting dietary changes all the time, with the kids that I serve. So I find that to be really fascinating. And how about the decrease in congestion with those changes or?
Oh, definitely. From just going gluten-free, casein-free, she had multiple ear infections and tubes, and she had pretty much stopped. She's had one ear infection in the last 3 years.
Fantastic. Wow. What a great change.
My other kids also, they're not sick as much. And
yeah. It's interesting because I end up telling parents about, different diets again, to just discuss them. But, always letting parents choose. And one of the things that I learned in a course actually from Dr. Wohler is, all of our simple carbohydrates are what, increases yeast. And then we have to, be on nystatin and diflucan and then all these other medications that they have to do to kind of combat that. And then, do the probiotics on top of that to be able to assist. And, getting them off those processed carbohydrates has been such a huge success. And, Michelle, I know that you do some of that too. You want to talk about that or?
Sure. We have been dairy-free, casein, gluten-free since birth. The one time somebody said to me, "Oh, whole milk is fine. Raw milk is fine. He will do fine with raw milk. Raw milk doesn't have the type of stuff that the other type of milk has." So we tried it, and within 2 hours, his behavior went off the wall. Bouncing off the walls like a madman, and his eyes were huge. They were swollen. He looked like Muhammad Ali after a fight. And so at that point we knew, okay, just no more dairy. On Friday I think he got a little piece of gluten from one of the other kids.
Yes. Oh, that's right. We had a photo shoot on Friday.
And definitely by that night, congestion, his nose was running, his eyes were watery. So gluten and dairy definitely make a difference for us. We're still battling congestion, and I need to get to the bottom of what that is. I'm not quite sure. His diet could be a little bit cleaner. He loves, loves, loves French fries. And so I need to figure out a way to make them better.
Yep.
And that's really, his diet's pretty clean other than that. But I have a hard time saying no because I know he loves them so much. Like, it's his favorite food.
Yes.
Other than, he loves all other kinds of food too. But if he's going to ask for something, typically it's going to be French fry. So
I can't blame him. It's my favorite too. But it is, I mean, I love what you're saying, Michelle. It's like sometimes that's all we need to do is from a dietary standpoint is just make it one step healthier. And, and sometimes that can be really challenging. And it can be, as little as, okay, we're going to decrease the salt and increase like some nutritional yeast, or, we're going to not put it in vegetable oil and we're going to put it in coconut oil, or, I mean, just making those steps to be able to make it, that much more healthy. And I think taking those tiny steps is a huge, I mean, you've done huge dietary steps too, but taking those tiny ones and just going, okay, we've done this. And now how can I just do it one step cleaner? I love the Alexa organic fries. Have you?
Yes, he loves sweet potato fries. Those are so good I feel like I need to take it one step past that because or just, do like green beans that look like fries or something, because he is just like, I can just tell that potatoes are, not.
Right. No, I know
but
what you're.
Hard. And it's a struggle, and I understand parents that, I mean, taking it one step it has to be that. It's hard because when you know that your kid loves something and they're going to actually eat it, like chocolate, right, Jen? Like, you want them to eat, so you give them what they'll eat. That is like, what.
And then, we also struggle with pleasure, just pleasure and enjoyment. You see his face and it's like, woo, French fries, woo, chocolate. I mean, it's, we want to have that pleasure. I mean, that's what mealtime is all about, is us as feeders giving kids food and them enjoying them, which is why sometimes we get stuck in that rut, because we want them to enjoy food. We want them to experience pleasure in something that is, a little bit more difficult for them. And so it's just being able to, take another step. So another way, Michelle, is taking white potatoes, yellow potatoes, and red potatoes and mixing them up and cutting them up yourself and frying them, but mixing up the three, because what happens is that they can get stuck on the white potatoes so often. And there's, yellow and red out there that are more flavorful, more nutritious, more delicious, and mixing them up and calling them rainbow fries has been really successful in my practice, just because, we get stuck on that white taste, right? That could be something that you could try.
I'll try that. Thank you.
Yeah. It's one of my favorites. I bake them and it's really good. So with chocolate, let's talk about some strategies for chocolate. So when we were talking about rolling up some of those, chocolate cereals or muffins, we can use that as a dipper. So we can even use like chocolate fondue as a dipper for foods. And it could be a fun rule. We can't use our hands. We can only use, whatever it is, usually something that's kind of bland, like jicama, or something to be able to dip into the chocolate fondue. And you could just make a game of it. One hand can go on your head. What?
Like veggie sticks?
Yeah, veggie sticks. I like jicama. It's like it's a white, you can cut it into like a little dip and fry, because there's a little bit of flavor in that. It's nice and cold, and it sticks to chocolate really nicely. And oh, hi. So cute. And
say hi.
And then, oh my gosh, so cute. Hi.
Say hi.
I gotta laugh! Yay!
Are you a dinosaur?
Sounds. And Lindsay saying, so cute. Oh my goodness. Such adorableness. And then using that as a nice dipper to be able to kind of do that. Now, what he's going to do is eat all the chocolate, right? He's probably not going to take a nice bite into that veggie stick or vegetable or fruit, whatever it is. But the thing is that he's going to get the sensory aspects of holding that and having that motor planning of putting that strawberry in, putting it into his mouth, putting that carrot in, putting it into his mouth. And so slowly but surely, it's less and less chocolate that you're giving. And
because the chocolate's just desperation now to get him to eat sleepy.
Yes, absolutely, of course. And so it's just, managing that.
So like as a dipper, trying to get him to eat, say, bananas, would you cut them in a little tiny chunk, or would you cut things more in a stick shape so that he can?
Yeah, I like stick shapes when I'm trying to teach them to experience something else or to be able to, I will usually cut the bananas into, because you want them to be kind of short because bananas fall apart easy, but I put them in the freezer and freeze them. Okay. Or you can use a lollipop skewer and into the banana, and you can slice the bananas in circles like this and stick a lollipop skewer and then freeze it and then put it into the chocolate, or even dip it into the chocolate and freeze it all together. Okay. And so those are, really nice. Michelle, you have a comment on this one?
I was just going to say, over here, could you try an avocado chocolate pudding? That is a fabulous
idea. I love that.
It is so delicious. I have a recipe for a pudding with, it's like, I've made it a few times.
Avocado, honey, cocoa.
Yes, dates, coconut oil, and cocoa powder.
Yeah.
And it's so good. Yeah, and that's another thing. You can freeze those into pops too, like little popsicle sticks. I mean, popsicle molds. Hi, Jacob. Yeah. We have a question over here. I have a 21-year-old with Down syndrome, and I am so happy feeding was never an issue. I didn't have the support that you guys have. Thank you so much for your comment. Yeah, it's amazing when I hear such great success stories that feeding wasn't an issue, and that's wonderful. Is your child, well, your adult now, really verbal and have good language? Yes. Yeah. And I love hearing that, because feeding does, it's a precursor to good speech and language. And I was just going to ask that, and how is the social skills? And she wrote, she's very social as well, because that's what we're trying to get, right? We're trying to have our kiddos, be good feeders, have good speech, have good language, and be able to be social. And she was prom queen. What? That's amazing. Wait a minute. Do you want to come on and tell us about that? Somehow we lost Mary. So let me have her come in and tell us all about that.
Hi, how are you ladies?
Hi, Elise. Thank you for joining us. Hi.
Thanks. I have a 21-year-old who is amazing. Luckily, I didn't have feeding disorder. She didn't have any feeding problems at all. And I was really lucky. She breastfed. They told me in the hospital she wouldn't, and she did. She wouldn't take any nipple. They sit there and, oh no, you got to try all these nipples, blah, 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 blah. And she was my first child. So I was like kind of thrown. And so finally I said, you know what? Because she was, she had PDA, so she had the Canlins and the whole 9 yards. So, and then I started nursing her, and bam, she was fine.
Of course.
And then so it's like, because I said the whole time I was going to nurse her, and that's what she was waiting for. So I think that helped with her development. Her sleep was a lot better when she was younger. First thing that happened, she had a stroke when she was 7 because she has Moy disease. Second thing that happened is when they get their bigger teeth. So once when they get their larger teeth, their speech does go down. It's unfortunate, but it does happen. Mm-hmm. Fortunately, and unfortunately, she has my speech pattern. So she speaks very quickly. So I have to tell her to slow down and articulate. but we've been, 2 brain surgeries later. She does have celiac, so we were forced to be gluten-free.
Wow.
So yeah, she was forced to be gluten-free. She's happy she's amazing. Right now she's at work. Has this internship she goes to every day.
Excellent.
Yeah, so she's just texting me as I was calling you. She reads well. She can text, obviously. If it wasn't for her stroke, I think she would be a lot higher functioning than she is, because she had several TIAs, and then she had a major stroke, and then 2 brain surgeries, and that's 7. That's right, critical at that age. That took like a lot of time from her, academically. And then I moved to a different state, which I moved to Florida, and their laws here are terrible, as far as education. But it is what it is. She's doing well. She was actually prom queen. That's why I came on. She literally was prom queen, not a gimme prom queen. Since they can be educated longer. Yes, she was in school, high school, for a longer period of time, and I've called her the mayor forever, because she was always so friendly and so kind and so outgoing. So my grandfather was a child psychologist, and when she was born, he had said, Elise, it doesn't matter what her IQ is, just have her social. That is your number one goal. Just have her get along in the world, and she'll be fine.
Yes.
So I took his advice, and thank God I'm an extrovert. And that was it. So she was the mayor, and she actually won. And there was a typical homecoming king. If you actually, you can Google it.
I will actually.
Yeah, her name is Sydney Davis. Put Sydney Davis prom queen, Oviedo, Florida, and you will see her everywhere. She was on all the news. She was. A lot of the Associated Press picked her up. This was in 2015, November of 2014. Okay. 14. Yeah. Okay. So she graduated in 2015, so it would be 2014, the fall. But I'm glad you guys. I come in and I look. New moms with new babies, and they're awesome sauce, and they're the biggest loving teachers that you'll ever have in your entire life. And they just touch her life. And I'll tell you, my Sydney, she loves karaoke. She goes out there and goes on world tour. And you can't tell her she's not on tour when we go on a cruise. I take her on cruises just so she goes on tour.
Oh, that's great.
And let me tell you, she cannot sing, but she is an entertainer. And she gets up there, and you can Google that too. You can just Google Sydney Davis, Proud Mary on YouTube, and you will see her. I'm going to actually put 3 or 4 more YouTube videos up there. It's so funny because she keeps watching herself, and she goes, "Mom, look, I have 127 likes." Like, you know. But I don't say anything. I just let her go. She goes on world tour, and when she's on a cruise, everybody knows her, and they come up to her and say, "You're fabulous," and she's like, "I know." And it's been a wonderful thing. So I'll tell you, I'm so glad you guys have each other, because the world's different than it was 21 years ago, and you can connect with people all over the world now, and you can hear these great stories. Look at that baby! Oh my God, I want to eat it. So I just see Downies, and I just love them, and I call Sydney the Downs diva.
I like that. I like that.
She, it's funny, and there's a lot of parents. She has a lot of Down syndrome friends, and the thing is like, the one thing I do have, we do have problems with her overeating. She is
right. Yes.
And she's finally learning, portion control.
Right.
So it's kind of hard with that, because now we don't want to get into the diabetic stage. You're always chasing something.
Absolutely.
But she, we don't eat processed foods, obviously. I don't understand this diet that you guys are talking about, so please share whatever diet it is. I don't know what you're talking about. It's an acronym for something, I'm sure.
Yeah. We were talking about the GAPS diet, and then like low sugar diets, and gluten-free and dairy-free diets. Taking out gluten.
GAP diet.
Yes.
Gluten, dairy.
Go ahead, Michelle.
GAPS is psychology diet, Gut psychology, something.
Okay.
And
Psychology. Yeah, yes, you're right.
you know the author?
I don't know the author. Okay. Syndrome.
Gut and psychology syndrome. Thank you, Morgan. You know the author of that? Morgan might know. I can't think of the author, but I need to order the book because that's our next step, I think.
There's another good book by Julie Matthews. She's a certified nutrition consultant, and her book is called Nourishing Hope. And when I read it, I really felt like I only understood 20% of it. And then I had to go back and read it a couple of years later, and I think I gleaned another 20%. But so it's very, very technical. She goes on public speaking events with biomed physicians all over the world. And he talks about every diet, like a specific carbohydrate diet, a GAPS diet, a gluten-free diet, a diet, low sodium diet. She goes through all these different diets for kids with Down syndrome and autism. And I want to say it's like $20 or something like that. It's a paperback, and it's called Nourishing Hope.
Yeah, thank you for that. I appreciate it. I mean, I'm just so glad that you guys, like I said, thank you for your comments.
Thank you.
Yes.
Somebody has a question about drinking.
Yes. We're gonna start there. So Morgan is saying that she loves your story, and she's asking about drinking. And so Morgan, if you feel like you want to come on, just put that out. Okay, thank you.
Meeting you, ladies.
Thank you so much for
Thank you for all you've done for our babies.
Yes.
Thank you for all you've done for our babies. You guys fought hard spot battles, blood, sweat, and tears to make it sort of, I feel like it's the yellow brick road for us because of everything that you did ahead of us. And I can't ever thank you enough, and the hope and the pure joy that seeing your daughter and seeing Connor Long and seeing these amazing adults with Down syndrome, that there's nothing that can stop them, is the biggest gift.
And I'll tell you though, if you guys follow me, if you have any issues with school, because that was my thing. I'll be
contacting you, Elise.
When they hear my name, I'm just saying. So the school boards just hate me, but it's okay because it's a good thing. Then I get curriculums, and I did it for my kids. And if you're willing, if you're the type of mom that is willing to do the work, you can get anything you want. You just, unfortunately here in Florida, they said, "Oh, Elise will do it." You know what I mean?
Wow.
Yeah, that's what they did. And then my Sydney's first year of high school, everybody's telling me about this great teacher, right? Oh, she's awesome. She's this, she's that. I'm like, wonderful, great. I don't have to do anything. I get the next day, the end of the marking process, can I see her books? Where's her workbooks? I need to see what you were doing. And she's like, what are you talking about? I'm like, what are you talking about? I can't write her IEP unless I see what she's been doing.
Yes.
And she's like, he has none. He have no. Well, I just went crazy. And of course, everybody, all the other parents in her class, because they went all the way up to the school board and, I shook the tree. The parents got angry with me because I made the teacher cry. Well, I'm sorry, but the following year they got a full curriculum. So that was my goal. My goal was not for her to cry. My goal was to get my child a curriculum. So that's what I had to do. So if you guys need help, my name's Elise. Just shoot me, at Gaia Traveler, whatever, follow me. And I'll put my email address, my personal email address right here.
Wow. Fantastic.
And then just email me. Okay.
And for those of you who are new to Blab, you can, over her face, you can see her information. You can just click on it and add her as a contact. And if you follow her on Twitter as well.
Yeah. So then, no problem, because I'll be more than happy to help you guys. Because believe me, I know the laws. I can tell you exactly where to find them. I've read that more times than once.
It's funny, Elise, that's one of the questions that we've been getting asked too, and I think that's going to end up being an upcoming Blab, is talking about how to manage school districts when you have a child with special needs. So I think I
was going to do one, actually. A woman friend has an autism child, child with autism, and we did a blab on how the topic is just how we just want them, just asking questions of how it is to be a parent with a child with special needs, because a lot of people are afraid to ask, look,
Right.
whatever.
Right.
And, I just treated Sydney loud and proud. I was loud and proud. I tell people she has Down syndrome. I tell other people, like, oh, my daughter's Down's. Like I would say she had red hair. It doesn't matter to me. I say, and that's the way you deal with it. If you sit there and you say, oh, yeah, she has Down syndrome, and man, she's a hoot. That people will then react in kind. Yes. And some people you get, I'm sorry. I'm like, why?
Right.
I don't know why you would be sorry, because I love it, and she's awesome, and then they change their attitude that fast.
Yes.
So, but I'll put my email in here, and then
please do. And please send it to us when and if you do that blab, so that we can watch and join in. So that would be great.
I'll put my Gmail.
And Morgan, if you'll get ready to come on to, Elise, thank you so much. That was just so amazing. A wonderful story. Thank you so much for sharing.
Have a great talk.
Bye. And Morgan, come on whenever you can, or Mary, if you're still here, come on. Try to get in that seat. And we only have a few more minutes left. I cannot believe how fast an hour goes with these blabs. It's just incredible. And there's the email for you guys. He is so cute.
We like him. My daughter is 8, and she's just proud as can be. Well, so it's my other son is 6. But she told one of the other moms at school, my little brother has Down syndrome, and he's so cute. He's even cute for a regular baby.
How cute. That's a great comment. So Morgan, it doesn't look like she's going to be able to come on, it looks like, but she wrote a story here. So let's talk about this. So my son is 2 years, 4 months, and he has Down syndrome. He's a pretty good eater. My main question is about drinking. He drinks exclusively from a straw cup, specifically the take and toss straw cups. Okay. When teaching him to drink from a straw, we sang lots of songs, and after each sip, we would celebrate. The problem now is that he won't drink continuously. He drinks one sip, pauses, then takes another sip. He's been doing this for more than 6 months. Any suggestions on how to teach to drink more than one sip? Yes, there is. I'd have to disconnect for just 1 second, but I can. Oh, that's okay. It's all right, Morgan. I understand. I'm just gonna walk away for 1 second to get the straw that I'm hoping to share with you. So I'm so sorry to leave, but 1 second. Jacob will entertain us.
Of course, all we do is put chocolate milk, and usually Jacob's dairy free and just as coconut milk. But man, if he gets a load of chocolate milk in a straw, he'll drink the whole thing in about 10 seconds. So probably not what she would recommend, but that's how we got him to drink quick from a straw. Maybe not quick, but continually.
Max decided to play the ukulele while in the background, and so I had to stop him.
Is he offering lessons?
Yeah, if you need them.
Hi, Jacob. So Morgan, here are a couple of suggestions. This is a honey bear, and so I usually use it to introduce straws, but this is just a nice way for you to be able to squeeze while he's drinking and to kind of keep that continuous sip going. You can get this at talktools.com, talktools.com. Another one that I love is this Bionic Straw. And of course it goes flying. You can go onto their website. It's BIONIXMED.com. There's tons of amazing products that they have in there, but the straw is one that basically it doesn't take as much work, and usually our kids end up straw drinking is, again, they're trying to breathe. So they're taking a small sip, taking a breath, taking another small sip, taking another breath. And here is the straw and what it kind of looks like. And so it allows the liquid to stay up in the straw. So it's easy for continuous sucking. And Morgan, are you going to be at my speech on Friday?
No.
Oh.
Still not, but I'm going to see her Friday afternoon, so I'll bring her one.
Got it. I'm like, oh, I'll bring this. Okay.
What if it's behavioral?
Well, so here's the thing. I always look at behavior kind of almost last. Because to me, it's like, it's usually a respiration issue. It's usually they're trying to breathe because he has a skill down. The skill is being able to suck. So the skill's there. It's just a matter of being able to hold your breath for a certain amount of time to be able to do that usually, or it's that they're just not quite sure. So just giving a little bit of give with this kind of to let the oral motor skills kind of evolve to make that a little bit easier. And again, you could squeeze this just a little bit and it will shoot out. So you have to kind of manage that, maybe suck on it a little bit yourself to be able to or make it a little thicker to make that a little helpful. I have many honey bear cups. He learned that cup, but then developed a pure hatred to it. Thus taken toss is now the only thing he'll drink from. Yeah. So that's another reason why I like this particular straw is because it keeps the liquid up there. And then you can really tell if it's a respiratory issue or not, because the liquid is there ready and available. He doesn't have to suck. And so it's right there ready for a more long continuous suck. So that would answer it right away. If you decide to get that straw and it is still a difficult problem, then we might be looking more at behavior. So then you can, talk about sucking for a few seconds or singing a little bit of song while he sucks. There's other strategies, but 9 times out of 10, it's respiratory. So I usually try to do that. You're getting any other questions before we go? And Morgan, I'm happy to answer any other questions too later with straw drinking. How about Mary? Are you still here? Is any other questions from you? I felt like we lost you and we didn't get you back. I don't know if you're still on too. So we're talking today about tips for feeding children with Down syndrome, and I'm just so grateful to Jen and Mary and Michelle. Thank you so much for all your questions, advice, and expert tips to be able to help therapists and their parents. And again, we are Easy Peasy, and we do a blab every single month talking about feeding challenges for kids. And today we're highlighting Down syndrome for the month, and we're so happy to have you, Mr. Jacob, on and showing everyone how cute you are. So I'm going to stop recording. Thank you so much for joining us.
Say bye-bye. Thank you. Say bye.
All right. Bye-bye. Did you just blow his kisses? You blew his kisses?